Are you one of the many hopefuls oiling India's 20,000 crore cosmetic hair care industry? While its sales count has grown and thickened, your hair count just never did. Around 85% of men and 45% of women suffer from hair loss. Hair loss not only affects appearance but also destroys confidence, interpersonal relationships, and even careers. One survey reveals as many as 75% of all women think that balding men look less attractive. 14% more men with full heads of hair were selected for job interviews as compared to men with less hair. Having treated thousands of hair loss patients over 40 years, I've seen that one of the most common and most dangerous misconceptions about hair loss is that it is a cosmetic problem. In actual fact, it is often the result of an underlying medical condition. There are 40 different health disorders that could result in hair loss, including anemia, nutritional deficiency, thyroid, diabetes, and polycystic ovarian syndrome. So let's stop you from running from parlor to parlor, trying product after product, by giving you the facts on hair loss. A certain amount of hair loss is normal, so no need for panic attack when you find a few strands in your brush. Overall, I find people overly disturbed and depressed over hair loss, which in itself further aggravates the problem, sort of like a catch-22 situation. You worry about losing hair, which causes you to lose more hair. In treating hair loss, what's important? Go to the root of the problem. The cause for hair loss in different people is different. So is the treatment. Hair loss treatment has to be individualized and personalized. And why homeopathy is so successful with hair loss is because its solutions factor in each patient's unique case history, including all physical and psychological symptoms to diagnose the cause of the problem. For example, when hair loss results from excessive stress, acid phos may be given. When women lose excessive hair after delivery, the remedy sepia may be suggested. If your hair loss is aggravated after taking antibiotics, nux vomica may help. In case of nutritional deficiency, especially iron deficiency, ferrum phos is often given. For patients who lose hair due to hereditary problems, thuja may be recommended. Thuja is a natural DHT inhibitor, DHT being the hormone that triggers hair loss. Hair loss problems largely result from a lack of knowledge on proper hair care. Let me correct a few misbeliefs and replace them with some simple suggestions. The first myth is that hair oil is some sort of cure for hair loss. No, nothing like that. Hair oil merely conditions hair, making it softer and more manageable, but has little medicinal value. In fact, if your scalp is oily, you don't need to apply hair oil at all. Here are some simple steps I recommend. Step 1. Instead of adding oil to your hair, add protein to your diet. Hair is protein, so eating dals and soya bean will help. Step 2. What you also need to include in your food is folic acid. Get your folic acid from beans, citrus fruit, and leafy vegetables. Step 3. Stay away from chemical hair products, blow drying, perming, and strong ammonia colors. All of these can cause damage to hair and lead to hair loss. Step 4. Treat dandruff as often. That's the reason for hair loss. Anti-dandruff shampoos are not the answer. They contain strong chemicals and only provide temporary relief. Dandruff is often associated with skin problems like eczema, psoriasis, and seborrheic dermatitis. So while local treatments may be a quick fix, you need to consult a homeopath for a long-term solution. Commercial hair care is as false as Delilah. After losing both money and hair, no point asking why. Instead, simply adopt my Sasta solution for Sundar and Tikau Bal. Till we meet again, stay healthy, stay happy.